So I am super excited to chat with Dr. Bindiya Gandhi as we are going to talk about leptin. So yeah, you're going to learn a lot about leptin, and let's go ahead and dive into Dr. Bindiya's impressive bio here. As Dr. Bindiya Gandhi is a double board certified integrative and functional medicine doctor who helps thousands transform their overall health. She is the medical director at Atlanta Functional and Integrative Medicine, Revive Atlanta MD, a comprehensive clinic focused on total body healing, including decreasing inflammation, improving hormonal balance, helping women get pregnant, weight loss resistance, chronic stress, gut health, and more. After dealing with her own medical crisis and eventually improving her overall health to rebalance her hormones and conceive naturally, she has been focused on finding the cause of issues instead of treating the symptoms and holds a special passion for female hormonal cases. So Dr. Bindiya has worked with A-listers, including professional singers and athletes, to reclaim their health. Her newest podcast, Reset, Renew, Revive, has gained tons of traction since its launch in April 2021. And Bindiya regularly engages with her community of approximately 65,000 followers via Instagram, where she produces compelling content and educational material to continue to inspire people to live healthier lifestyles. And thank you so much for joining us, Dr. Bindiya.
Thank you so much, Dr. Eric, for having me on. I'm so excited to talk about leptin.
Yeah, really excited as well. And, so before we do that, of course, as is common with many podcasts, I like to talk a little bit more about the background. So we got a little, brief history of your background, but what led you to really become kind of like a leptin specialist and focusing on female hormone issues?
Well, I always share the story of my own personal journey, and I thought I was the epitome of good health in residency. I thought I ate well, exercised well, I was meditating, I was doing yoga all the time. I thought I was doing everything right. And it was my own health crisis. And at the time, it was a skin rash on my face that really triggered that something was going on internally. And I had spent time, hours, money at all the dermatologist offices, and was told that everything was normal. I had biopsies. I was on antifungal, steroids, antiviral. I don't even know, antibiotics. I took everything because I was desperate to get this rash off my face, and nothing worse, nothing worked. And I kept asking questions, and I kept digging deeper. And I even begged, thinking, could this be an autoimmune condition? Can you get me tested for the autoimmune condition? I was finally, after begging, was allowed to go see the allergist immunologist, who then told me I'm just a stressed out resident. And that was like the turning point. I was like, there's something going on with me. You guys can't figure it out. I'm going to figure this out on my own. And fortunately, I was working with an integrative and functional medicine doctor at the time. And long story short, learned I ended up having celiac and a lot of food sensitivities and a lot of issues. The minute I cut out gluten, rash went away, never came back. And, that was just the beginning of the journey. Of course, once I realized that, I was like, oh, I'm healthy now. I'm good, right? Like that's just the first part of the problem. Then, of course, I got married. Life was stressful. I was working as a full-time newly minted family medicine doctor at a really busy practice, working all hours. I was actually, at that time, I was doing my integrative medicine fellowship and also doing my Institute of Functional Medicine training for functional medicine. So, pretty busy, no kids at the time, but I was trying to get pregnant. And it wasn't easy. And I didn't understand why, because, I knew the data, I knew the information. If you have celiac, you eliminate gluten, you should be able to get pregnant, right? I was eating clean, or I thought I was, right? But my hormones are all off. I was probably maybe too healthy at the time. There is such thing. There is such thing, and so took me a while kind of playing with things, fortunately, unfortunately, and realized exactly what it was that was going on and what I needed to do. And then I got pregnant. In fact, now I have 3 kids. It's not an issue. Now I'm trying not to get pregnant. So here I am. But as far as leptin goes, because I was, I started a new practice, and not so new anymore, but in 2017, I was I was 7.5, 8 months pregnant with my first child. And, I was seeing a lot of patients. People were coming to me because they wanted help getting pregnant. I was seeing a lot of menopausal women who were struggling to lose weight. And so leptin just kind of fell in my lap. I was doing research. I was trying to figure out how I could help these women with all these hormonal imbalance, not only get pregnant, but lose weight. And I started seeing patterns. And that's when I just started diving deep and learning more about leptin and everything I could so I could help these women. And here we are today. We're talking about leptin.
All right. Well, thank you so much for sharing that story. And so for those who are listening who are unfamiliar with leptin, can you briefly describe what is leptin?
Yeah, so it's such an important hormone. Unfortunately, it's not talked about. Leptin is a hormone that is produced by our fat cells. It communicates with our brain. It lets us know if we're hungry, if we're full, do we need to eat more or less, also known as our satiety hormone. Now, leptin is probably a big buzz right now because everyone is obsessed with GLP-1 medicine, right? And so I'm sure we'll talk about that a little bit later. But leptin is important because leptin does impact your metabolism, right? And this is why I think that we need to learn more about it. And once we're able to learn more about it, we're able to identify how we can help our patients improve their leptin resistance if that's what they have.
All right. And, so a lot of people I'm sure listening to this are familiar with insulin resistance, and then there's leptin resistance, which, which there is some overlap. But so essentially with insulin resistance, you have too much insulin not getting in the cell. And that's similar with leptin when you have leptin resistance.
Yes, correct. So, in a perfect world, not always, right? But in a perfect world, we like our leptin levels to be between 7 and 10, right? Over time, because of the standard American diet, because of life, stressors, medications, our environment, so many different things, our microbiome is changing, different sickness, ailments, autoimmune conditions, it changes our metabolism, and then we become leptin resistant. Now, I also tend to see, I'm going to use women more so than men, who do yo-yo dieting and have been on these strict restrictive diets like keto or intermittent fasting or all these different things over many years. It kind of slows down their metabolism. The metabolism has something called a set point, and the metabolism likes to be at a certain weight, right? Well, because of all these different things that are happening simultaneously or over time, we tend to notice that our leptin hormone is now slowing down and just starts accumulating and doesn't want to work as well. So what does this mean? So for a lot of patients who are eating while exercising and they're still having trouble losing weight, they're doing things perfectly. They're following, a calorie in, calorie out diet, and it's not working. They're exercising, they're at the gym, and they're still struggling. They probably have a leptin resistant issue, and that's kind of what this means.
So what are some of the causes of is it just pretty much diet related then as far as leptin
Not
resistance
necessarily.
is stressed or?
There's a lot of different things. There is definitely correlation between insulin resistance and leptin resistance. So other hormones also interplay with leptin. Ghrelin, which is the opposite of leptin. So leptin is the satiety hormone. Ghrelin is your hunger hormone, right? So they kind of work synergistically together, right? If you're hungry, you're going to eat, right? What happens with leptin is you are not getting the signaling that you're full. So an hour later, you're going to want to eat again. Or like 2 hours later, you're just like, oh, I'm hungry. I'm not full. I need to eat more, even though you ate, a little bit more. So the receptors of ghrelin and leptin are a little off, right? And they work together. Now, the other things that happen too with leptin resistance, we tend to see sometimes a thyroid issue, underlying thyroid issue that could be contributing to it. We tend to see things like a lot of inflammation. Maybe there's some infections or other, potential pathogens that could be causing a change in your microbiome or gut health, right? So there's a lot of different things happening at the same time that could be contributing to your leptin resistance. Sometimes it's all of the things that cause leptin resistance, and sometimes it's because of the leptin being off, the other things can be caused and be triggered as well. So they kind of work together.
So you mentioned thyroid, and of course, most of the listeners, if not all the listeners, are people with thyroid conditions, autoimmune thyroid conditions like Hashimoto's and Graves'. So you said if someone has a thyroid imbalance, that could be a factor with leptin resistance, and if so, I guess then you would want to address that.
For sure. So actually, sometimes it's not the overt, what we call hypothyroid condition. Sometimes it's a subclinical thyroid condition, which I often see in a lot of people. So what happens, again, I'll use this example, due to chronic stress, which is probably most of us, unfortunately. By the way, if you're listening to this and you're at chronic stress, I want to talk to you because I want to know what you're doing because I don't know and I haven't met anyone that is not dealing with some sort of chronic stress, right? So chronic stress over time, one of the things that happens is it starts slowing down your thyroid hormone, right? Maybe not your thyroid stimulating hormone, but it does slow down your T3 and your free T3 receptors, which then makes it hard for T4 to convert to T3 and can slowly manifest as a slowed metabolism, some dry skin, some constipation, some fatigue. So one of the things that patients complain of these symptoms, but they go to their general physician who just checks the TSH, and their general physician's like, your TSH is fine, keep going, you have a good life, right? And obviously, you and I probably do a little bit more digging, and we do a little bit more research, and we realize, okay, well, we have to check a little bit more than your TSH. We have to check these other numbers. And then when we look at the whole picture, you're like, yep, you do have a subclinical thyroid issue. We do need to address that. We do need to treat that because that does impact your metabolism. That does impact not just the stress, but the chronic T3, free T3 being low really does impact how your leptin is talking to your hormone.
And and you're right. A lot of people do have that conversion problem, T4 to T3. And so obviously you want to, there's a time and place for taking T3, but you want to ultimately correct that conversion problem. And then you mentioned the gut microbiome. So many people have gut microbiome issues, not just those with thyroid autoimmunity, although certainly people with Graves, Hashimoto's, most, if not all, have disrupted gut microbiomes. But so that you said also can play a role in leptin resistance.
Yeah, so many of us, I'm probably guilty at some point, have had what we call leaky gut. I'm sure that term has been thrown a lot. Everybody knows what that is by now, or just an imbalance of good and bad bacteria, or dysbiosis. What happens over time, we develop a little bit of inflammation in our stomach or the lining of our stomach, and then foods that we eat, supposed to bounce off, supposed to kind of like, essentially bounce off the lining of the stomach, now is getting absorbed because we have some inflammation because of an imbalance of infection or imbalance of microbiome or infections or whatever it could be, right? When this happens, we develop something called food sensitivity, which means the foods that we enjoyed eating, like blueberries, now we're sensitive to it. We're having some bloating, we're having some gas, we're having some malabsorption when we eat it. Those are probably one of the big things I tend to see when you have over time with leptin resistance, just having a change in gut microbiome. If you've taken antibiotics for a sinus infection, it changes your gut microbiome, right? Again, I hate saying this again, but if you've been under a lot of chronic stress, I just saw a patient prior to coming here under a lot of chronic stress, changes the gut microbiome, right? So gut microbiome is so important for our overall health, but specifically for leptin resistance, because that change is really where for example, ghrelin is really housed in the stomach. This is your hunger hormone, right? Leptin is usually housed in your hypothalamus, which is a part of your brain, but ghrelin is actually housed in your stomach. So when your microbiome is off, of course, the communication of everything else is going to be off too.
So let's talk about testing and how people could discover if they have a problem such as leptin resistance. So I'm guessing you test leptin, and I mean there are other markers. I'm sure it's not just leptin. We spoke about thyroid, and maybe you look at also some other blood sugar markers like insulin, and yeah. So what do you test to determine if you have insulin resistance, and then if there are other blood? I mean, you don't have to cover everything that you test for, but maybe some of the more important markers that might be related as well.
So let's talk about this. Like, if you're listening to listening to this podcast and you're like, oh my God, that sounds like me, right? First thing I want you to do is, go to my website, take the quiz. It is a free quiz on Dr. Bindiya MD/quiz. It's an 11-question quiz, and it just kind of asks you a series of questions of, do you have trouble losing weight? Are you doing everything you need to lose weight? Do you have high cholesterol? Do you have high blood pressure? Do you have high blood sugars? Do you have a lot of sugar carb cravings? Answer that question, because it'll kind of also give you a guide of if you are leptin sensitive, clear, or leptin resistant. Now, if you take that little quiz and you're definitely coming up with leptin resistant, then what I'd like you to do is maybe ask your doctor. I don't know if your doctor is going to do this. I've had patients ask endocrinologists, and even endocrinologists will not check this hormone, again, because it's newer. We're still learning about it. But I do test it in most, actually probably all my patients, to see what your metabolism is doing and what is going on there, especially if weight is an issue. Now, in a perfect world, like I said, this is not always going to be the case, but in a perfect world, leptin is measured based on your height and your weight, right? Or something called your body mass index. All of our body mass index is completely different based on muscle mass and, how much fat we have, and so I'm not usually a big fan of BMIs personally. I personally, in our office, like to do body composition, and then we can kind of get a more personalized approach of what is really going on with your metabolism and your composition. But leptin should be between 7 and 10, and for people that have higher body mass index or higher BMI, tend to have higher leptin level numbers. When your leptin levels are higher, it usually indicates that it's harder to lose weight, right? Your body is slowed down. Your body is in a reserve and wants to hold on to that weight. It wants to protect you. It's like a protective mechanism. This happened many, many years ago when we were hunter-gatherers, and what that meant was we weren't sure when we were going to eat again, right? And so our body would store food for us as a protective mechanism. And that's kind of essentially what happens with leptin resistant, right? It's kind of storing the food so you get frustrated because you're like, but I'm eating well, I'm exercising, I've cut my calories, I'm doing all the things that all the books and all the experts are telling me to do, but it's not working, right? And so I will check a leptin hormone, and it'll give me an idea. Leptin hormone can rapidly come down with lifestyle changes all the time. With supplements, it can come down with prescriptions, and every individualized approach is different because we have to look at the whole picture. So in my case, I'm looking at making sure there's no underlying autoimmune conditions contributing to inflammation. I'm looking at the whole thyroid picture, making sure there's no Hashimoto or subclinical hypoactive thyroid going on. I'm looking at toxins to make sure that their liver's optimally working like it should, making sure there's no underlying infections. So it is a very comprehensive approach. But yes, the leptin number itself will give me an indicator of what's going on.
Yeah, so it's similar, like with insulin resistance, it's not always as easy as just cleaning up your diet and exercising. I mean, you certainly want to do that, but many times there is like an underlying inflammatory component. So it sounds like it's similar with leptin
And
resistance.
and I hate saying this, but most of the time, it's probably something lifestyle related. It's probably something that if we just gave it a little TLC, it would improve. For example, stress, right? If we learned how to manage stress a little bit better, or just really focus on getting good quality sleep. Maybe if that means going to bed earlier, or maybe that means we literally, are not going to do work an hour before bed so we can get, whatever it is. Everybody's different, right? But usually, I promise, I've been doing this for many, many years now. It's usually something lifestyle that we're doing or don't realize we're doing, or things that we could improve upon that will fix some of these things. It doesn't always have to be, we don't always need a prescription or a supplement or anything like that.
And then if I heard you correctly, you said, I think you said optimal levels are 7 to 10, but then it also is dependent on the BMI, because like if you do a leptin test, there'll be all these values. And then if you fall, so like if someone has a leptin of 25, but then they're within that BMI that's on the lab, they're considered to be normal, even though I guess the BMI might be higher than it should be for. So I guess can you expand on that just a little bit, just so people don't get alarmed if they see, or maybe they should get alarmed if they do see like a BMI of
Yeah,
15 or
I will
20.
say, so when I first started testing leptin, when I first got into this world, 10 years ago, I was just reliant on the BMI as a tool for leptin. And so I was like, oh, these women are all within normal ranges. Their leptin levels are fine. But then I'm looking at them and I'm like, well, they seem a little overweight, or whatever it is. But according to the and by the way, I'm using the LabCorp chart as a reference. So I'm talking about LabCorp specifically. I'm using the LabCorp reference, and it didn't add up. And again, that's when I started doing a lot of research about leptin. I was like, something is not adding up here, right? Like, according to the labs, which, by the way, I always kind of mention this because I think it's really important that we talk about this. When they came up with lab results, or averages of lab results. They take healthy individuals and they take unhealthy individuals and they put them in a pot and they take the average. I don't know about you, but I don't want to be compared to someone who's unhealthy, overweight, or older, or whatever. I want to be compared to the cream of the crop, healthiest people of my age, of my stature, etc. That's not what's happening when it comes to the LabCorp data or the LabCorp reference range. This is why, again, I was doing some more research and I was like, this is, with all due respect, BS. It doesn't make sense. It's not appropriate. You can't compare someone that has a BMI of 20 because you could put 10 women that have a BMI of 20 and they're all physically different. It does not make sense.
Mm-hmm.
And so that's when I started doing more research, and I realized the interval range is actually 7 to 10. So that is more of an accurate range than whatever, 20 or 25 or something that may look normal. And when you realize that, especially with the work I do, you see this number go down in the right direction, you see their metabolism is working better, and you tend to see that they're able to lose weight on their own by doing the things that they should be doing.
And then with insulin resistance, what do you use to determine that? Is it just hemoglobin A1C? Do you look at fasting insulin as well?
Yeah, lots of different things. Adiponectin, fasting insulin, hemoglobin A1C, fasting blood glucose is another indicator for me. Sometimes I'll have people use continuous glucose monitors. Not a big fan. Sometimes it works, sometimes it doesn't. I feel like sometimes we get false reading on those as well. But I like to do that. The other one I do like is the insulin resistant IPR score. It's one of the testings that we do get, and it kind of gives us an idea if someone is insulin resistant or not. So we do use different testing like that. But again, it's looking at the whole picture, because sometimes I look at hemoglobin A1C and I'm like, it's 5.5. But when I do the insulin resistance score, and I can't, my brain today, I apologize. I think it's HOMIR score. It'll be like, 69. And then I'm like, okay, yeah, they're definitely insulin resistant because that number should be before 40. So there's different markers I look at to see, because I'll get a fasting glucose, and the fasting glucose is 83, but then their A1C is like 5.7. So you have to look at the whole picture sometimes.
Yeah, I agree. I mean, sometimes I'll look at hemoglobin A1C, let's say, and it might be again 5.5, 5.6. So within the range, but kind of on the higher side. But then, I mean, sometimes insulin will be on the higher side, and again, I don't know what you consider optimal for insulin.
Blood sugars, blood sugars. Oh my goodness, I could talk about this all day. Mainly because there's also, again, I hate this, but there's a reference interval, because I talk to lab companies about all this time. It can technically be 0.2 or 0.2 up or down, either direction. So sometimes, even though we know A1C is 5.5, it could technically be 5.7 or 5.3. And you're just like, well, so which one is it? It could be really frustrating. But again, the way you and I look at pictures is looking at the whole picture and kind of assessing all these other markers as well. Because if you look at it, maybe like, oh, this person's not insulin resistant. But if you dig a little deeper, you're like, maybe a little underlying smidgen starting to start, And let's kind of nip this in the bud with a couple lifestyle changes.
Now, one question I almost forgot to ask about leptin. Can leptin be too low? Like, is it concerns if it's too low?
Yes, I'm so glad we're talking about this. So yes, we don't want leptin to be high, but we certainly don't want leptin to be too low. If leptin actually falls below 3, it slightly becomes problematic, especially in women who we notice are trying to conceive, or too healthy women, right? Leptin is also correlated with estrogen, and so a lot of times in my postmenopausal females, who also end up having a little bit of osteopenia, osteoporosis. Sometimes it's because their leptin levels are too low, right? So there's a lot of different things that we tend to see when your leptin levels are too low. So I'll definitely just highlight that. When leptin levels are too low, it can impact pregnancy, more likely to be osteoporotic, that kind of thing.
All right. So, and then when it comes to addressing leptin resistance, I mean, some of it you already spoke about, like if someone's chronic stress, which describes most of us, you want to do things to block out time for stress management, and and of course getting sufficient sleep. When it comes to diet, there's no perfect diet that fits everyone, but and there's a lot going with intermittent fasting, a lot of people doing that. So like what's your approach from a dietary perspective?
So diet is always so confusing because it's like, eat this, don't eat this. If you eat too much of this, it's going to cause this. Like, it's all over the place, right? But one thing that I will say, I can give you generalized guidelines. And what I will highly, highly recommend is to actually eat 3 times a day. Now, as much as I love intermittent fasting, I think there's a time and place for it. I think intermittent fasting is great for insulin resistance, and I think it works really, really well with insulin resistance. It does sometimes improve leptin resistance. However, sometimes it's extreme intermittent fasting that can sometimes trigger leptin resistance, okay? Because then the body thinks you're in starvation mode and doesn't know when you're going to feed it again, and then it's going to hold on to fat, right? And then that number will go up, and then it's going to store every time you eat because it's unsure when you're going to get fed. So sometimes it's a protective mechanism. Intermittent fasting is plus or minus. However, one of the things I highly recommend is forcing people, not forcing, but encouraging people to eat. Eating is good. We should eat 3 meals a day. Physiologically, this is what we should be doing, right? The meals should be about 4 to 6 hours apart, but we should be eating about 3 meals a day. And we should make sure that the meal is protein rich. So eating a lot of protein, 20 to 30 grams of protein a day. I think honestly after that you're probably not really absorbing it. Maybe you are if it's true animal-based protein, but if it's like a lot of processed protein or a lot of like plant-based protein, I think there's some studies that are showing that you're probably not absorbing all of that protein. So that's why I say 20 to 30 grams I think is pretty safe for everybody, depending on what's going on with you. Most people tend to do really well with that. And yeah, not only does it balance your blood sugars by eating 3 meals a day spread apart, but you're also going to get a good amount of protein in, which is perfect. So that is probably one of the first hacks I will have people do. That probably means that you're hopefully, and I didn't really say this, but hopefully it means you're also eliminating all the sugars, processed crap, and seed oils, and all the, I don't even know what exists these days, all the crap, right? We want to make sure everything that you put in your body is organic, clean, non-GMO, obviously, and all that other good stuff.
And so with protein, did you say 20 to 30 grams per meal?
Yes.
Okay. Just
approximately, right?
yeah. Okay. Yeah. So 20 so 60 to 90 grams per day if you're recommending like 3 meals per day. And then so you would try to avoid snacking because you mentioned like 4 to 6 hours between meals.
Yeah, ideally no snacking. And again, everybody's on a different path to their health, fitness journey, whatever it is. If you're someone that's really heavily working out, you're probably going to need to get your snacks, and you're probably going to need to get more calories in. So again, every single person is different, but on average, the goal is to have larger meals at breakfast, lunch, and dinner, and then let your body rest. That rest is important for your gut health, which is important, right? You're not just kind of putting stress on your microbiome and your gut, but also letting it rest, which is really important for healing it as well.
Yeah, and then you mentioned something interesting that, fasting potentially can cause insulin resistance, like extreme fasting, especially because I
Leptin,
do see, yeah.
leptin resistance, not insulin resistance.
Oh, okay. I thought you said.
No. So fasting is excellent for insulin resistant. It's excellent for insulin resistant, but extreme fasting can sometimes be the culprit for leptin resistance. I hope I explained that properly.
Okay. Yeah, I misunderstood. 'Cause I mean, I'll be honest. Like, even when it comes to when you say extreme, maybe it helps with insulin resistance, but I don't know if extreme fasting is good, period. Like if someone's doing, of course there's like the 16-8 fast. And I think for a lot of people that's okay. Even that, it depends on the person. But then, like I'll speak with people who are doing like 20-hour fast every day and, only have like a 4-hour eating window. And
No. And I can talk about fasting all day too. It needs to be done supervised. It needs to be done properly. You can't fast when you're stressed. You can't really fast when you're going through a divorce or something like your new whatever life is going on. It has to be done very strategically. And the biggest mistake I tend to see with a lot of my patients, and this is why I think they don't do well with intermittent fasting, is they're cutting their calories while intermittent fasting, which then causes a whole slew of other problems. So I hate intermittent fasting. I think if you do it right and you're doing it very appropriately, it works really, really well. But if you're not doing it right at the wrong times, and for females, unfortunately, we have a 4-week cycle that we have to consider we should fast and when we should not fast can actually be problematic, or it could be helpful. But yes, insulin resistance, it does tend to usually improve but if you're doing extreme fasting, like 36-hour fasting, 48 hours fasting, I'm not a huge fan of that. And I usually will, even when I recommend fasting for some patients, I'm also breaking it up where you're not doing 12/8 every day. It's kind of 12/8 a couple times a week. Maybe you're doing a 14/10 a couple times a week, and maybe a 12-hour. It needs to be realistic and make sense too, because we don't want to add additional stress in the body. But yes.
Yeah. And how about supplements? Are there supplements that could help with leptin resistance? And then also the GLP-1 meds and these
So
peptides and
yeah, so I am a huge, huge, huge fan of supplements. I personally probably take a billion supplements myself. I don't know about you, but I do. I'm trying to not to age these days. Let's be honest, right? But yeah, supplements really do help. There's a lot of good things. So again, we tend to notice that if your thyroid needs a little bit of help, maybe we support your thyroid with a supplement. For example, and I know that because if I'm checking your iodine, your selenium, your ferritin, some of these other things, and if we need to support that, we supplement you with that. But if we need to support your leptin, because we tend to notice that your leptin is a little off, there's a couple supplements I tend to like right now. One is acromantia. I don't know if I'm ever saying it right. It tends to work really well. It's like a natural GLP-1 agonist, which the data seems to be really promising on. The other one that I really like, of course, I'm sure everybody's heard of berberine. Berberine is great for blood sugar and insulin resistance, but it can also help with leptin resistance. It also helps with your microbiome. The problem I will caution with berberine, people who are taking it unsupervised on their own, and you take it for an extended period of time, I want you to be aware that berberine is also like an antimicrobial or antibiotic. And so it can also change, maybe for the better in a good way, your microbiome. But if you take too much of it, it can actually cause diarrhea and some other problems. So, I just like to kind of mention that. The berberine is also a great one. And right now, one of my favorites is Orthomolecular's Hyphenolic. It is a supplement that is targeted towards leptin resistance. It's got a little green tea extract in it, which kind of like revs up the metabolism a little bit. It is decaffeinated, which is good, but it tends to kind of decrease the appetite and cause that early satiety, like a GLP-1 agonist does. And so a lot of my patients do really, really well with it. Sometimes these supplements help these people. Sometimes they don't. Every single person's different, right? It also depends on the regimen that they're doing, how consistently they're taking, if they're taking it appropriately. But one thing I probably say, most of my results are probably from lifestyle changes for supplements. I'm just going to be honest, right? And of course, GLP-1 agonists work amazing. I do prescribe it in our practice, especially when I see women and men, by the way. I keep saying women, but I do see men in my practice too. When I see patients that have leptin levels over 100 or really, really high, there is a place for GLP-1 medication, and they do work fabulously. Sometimes they have side effects, sometimes they don't, and it works really, really well on that leptin hormone, and I see it directly in my lab results.
Now you mentioned akkermansia. With that, do you like if someone tests like I don't know if you do like for example GI map
Yeah,
and then
yeah,
that
yeah.
looks at akkermansia and then if they're less than detectable limits, that's when you recommend like an akkermansia supplement or
Exactly. So I usually am doing it based on, again, I'm a big tester. So depending on what their stool test shows, I will treat them accordingly. Yeah. Or if
yeah,
I'm
and then
suspicious of it, then I will. But yeah, usually based on stool test.
yeah. Okay. And then yeah, berberine, I've had this conversation. So I had I don't know if you're familiar with Dr. Jason Horlick on the podcast and we had a conversation with berberine because he's not a big fan of berberine because of the potential antimicrobial effects. And yeah, I mean, it can help in cases like SIBO. But there are also a lot of updated studies, which is really interesting, showing that berberine can benefit the gut microbiome. So, which is so like you mentioned before, you don't know kind of how it's gonna, I guess, affect the gut microbiome, and then obviously, yeah, if you're taking it and you're experiencing diarrhea, maybe listen to your body and either don't take it, or if you're taking a real high dose,
Yeah.
because
So you and I probably know, berberine just got a big buzz recently because of GLP-1 medications. You and I have probably been using it for the last like 15 years, right? Now, berberine for me, I was using it before for a lot of my insulin resistant patients because it's kind of has the similar properties to metformin, right? And so sometimes it's so funny because now everyone's about, oh, GLP-1 medication, berberine's the new natural GLP-1. I'm like, no, it's more like metformin. I don't know where you guys are getting this information from, but it actually acts more like metformin does. But yes, it does. It does work the same. The concept is the same, improving the blood sugars, improving all these other things. But yeah, it's interesting. But yeah, yes, I agree. It does help with infections. It does help with SIBO. It does help with a little bit of yeast overgrowth. So I mean, berberine is not necessarily gonna hurt anybody. However, long periods and extensive, like you being a year on berberine, probably not a good idea. And that's what I guess I want to kind of clarify, right? Like short term being on berberine, probably going to get some great results. It's going to help you at the right doses. But if you're taking it for a very long extended period of time, not good. Also, if anyone's listening to this and is trying to get pregnant, you're not going to get pregnant on berberine. If you're breastfeeding, probably not a great option for you. So there's certain populations where it works really well for. Another population, you should please talk to your provider and think twice about starting prescriptions without, talking to a doctor.
all right, well said. And anything else? Anything that I should have asked you that I didn't ask you, or anything else you want to talk about related to leptin resistance?
No, I think it's a fascinating topic, and I'm excited as new data is going to emerge over the next few years, what we're going to learn about it and our metabolism and how to optimize our health. I mean, I'm hoping that that this is going to empower us to be consistent with some really good lifestyle changes where we can just kind of, I joke, age backwards, but more importantly, literally just kind of like biohack our metabolism so it's working for us. And we're gaining muscle, not fat, as we age.
All right. Well, this was a wonderful conversation. And Dr. Bindiya, where could people find out more about you? Feel free also to mention your quiz again that people could
Sure.
take.
Yeah, you're more than welcome to follow me on Instagram, social media, Facebook, all that stuff. It's at Dr. DRBINDIYAMD. Everything's at Dr. Bindiya MD. Instagram, TikTok, all that good stuff. YouTube. I don't even know what else there is these days, social media wise. Threads apparently. But yeah, you definitely follow us. But my website is www.drbindiamd.com. And then our practice is Revive Atlanta MD in Atlanta or Decatur, Georgia. And our quiz, you're more than welcome to check out our quiz. It's a free quiz, Dr. Bindiya MD /quiz. And I do have an amazing metabolism makeover course. So for people who are not able to work with me and who want to kind of jumpstart their metabolism, it's an amazing 28-day course that you can start and finish at your own time. And it's great because it really takes you to all the things that I do one-on-one with my patients without doing all the blood work. Obviously, I love working with my patients one-on-one. That's just the type of doctor I am. However, people live all over the country, all over the world. And so I honor and recognize that. And so we have a metabolism makeover course that really helps jumpstart their metabolism. We've had some amazing results on it. And it's a great way to literally start making the right health moves or lifestyle changes, I should say, to really biohack and just really get you to where you need to be.
All right. Well, we'll make sure to include the links to everything you mentioned in the show notes. And thank you so much. Again, this was an amazing conversation. Really enjoyed chatting with you. And I'm sure the listeners learned a lot about leptin, and I learned a few good things as well.
Perfect. Well, thank you so much again for having me on.
Yeah. Thank you. Have a great day.